Good afternoon. Welcome and thank you for attending this Ask the Doctors webinar on COVID-19. This is a difficult situation that New Brunswick Public Schools is following closely to make sure we're able to provide as much assistance as possible to student families. At every step of the way during this extended closure, the school district is here to support you. Before we get started, we'd like to give a grateful thank you to the New Brunswick Board of Education for making this important resource available to the community. I'm Eshaya Draper from the Office of the Superintendent, and I'll be moderating today with Dorenia Villalona, Assistant to the Superintendent. We want to especially thank our medical experts, Dr. Shilpa Pai and Dr. Amisha Malhotra from the Robert Wood Johnson Medical School. The doctors will be providing us with real information and giving us important tips on keeping ourselves and our families safe. The doctors will be starting soon with a presentation on COVID-19, and then we'll move on to take questions that relate to the virus outbreak afterwards. Dr. Amisha Malhotra is a pediatric infectious disease specialist. She's also an associate professor of pediatrics at Rutgers Robert Wood Johnson Medical School in New Brunswick. Alongside her is Dr. Shilpa Pai, a pediatrician at Eric B. Chandler Health Center. She is an associate professor of pediatrics at Rutgers Robert Wood Johnson Medical School in New Brunswick. This webinar is also being provided in Spanish simultaneously with translations provided by Dr. Andrea Fontañez from our district's bilingual education office. We'd like to also notify you that this webinar is being recorded for informational purposes and will be shared on the district's website at nbpschools.net to be watched and reviewed as many times as you'd like. As we get ready to begin, you are free to communicate with us through the commands on your screen and through the webinar chat box. We'd like to hold any questions until later, but the doctors may address any pressing questions you have in the chat. If you have filled out the questionnaire attached to the event information, we've added your concerns to the list of questions for the doctors. For anyone just joining, this is the Ask the Doctors webinar on COVID-19 provided by the New Brunswick Board of Education. Most importantly, we want to thank you for being with us today and being a recipient of detailed information from these busy medical experts. It is now my pleasure to welcome Dr. Shilpa Pai and Dr. Amisha Malhotra.
Thank you very much. First of all, I want to thank you for this opportunity. I know this is a time of a lot of concern. This is pretty unprecedented, at least in my lifetime, and I'm sure many of yours, where we've had to deal with something this large on such a large scale affecting each one of us. So I think this is a great opportunity for us in the medical field to reach out to all of you and, just try to give you some education on what we know, and more of all, just to get some questions and hopefully, what we can answer for you. So I will start with our slide. One thing on this slide, I want you to know that there is a lot of information on the CDC website, and especially for families and individuals. So I highly recommend that you could certainly use this website in addition to whatever we're going to tell you. But I think the CDC website is a great tool. The WHO website, which is the World Health Organization, is also a very, very useful site to get more information. All right, so let's get started with what is COVID-19. It stands for the coronavirus infection that was originally founded, I would say, or discovered in Wuhan, China in 2019. That's where the 19 comes from. So it's a new coronavirus that hasn't been identified in humans before. It's, we've seen there are many types of coronaviruses, and they usually give you mild illness like the common cold. This is not the same coronavirus. This is a different type. And why is it called COVID-19? The CO stands for corona, the VI for virus, the D for disease. So COVID and 2019 was when it was discovered in Wuhan, China. So, a lot of the questions are, we know what this virus is. What does it mean? How long does it last? And as we get more and more studies in, we've found that this particular virus can last anywhere from a few hours to a few days on surfaces. So it's very important when we say that we clean and disinfect your high-touch surfaces daily, especially if you have someone that's sick at home, right? If they have the virus, like tables, hardback chairs, doorknobs, handles, desks, toilets, sinks. So it's important to keep those areas clean, especially, we do that routinely, but especially if you have somebody that's sick at home. And that's why it's important to isolate people who are sick in a specific room, decrease cleaning frequency as needed. Okay, you don't want to have unnecessary contact with the sick person, and we do recommend a separate bathroom if not available. Then you just clean and disinfect the bathroom that you have. All right, so these are just some basic things that we talk about with families about what to do and how long this stuff can last, because we do know that this virus can last a few hours to a few days. So how does this virus get around? All right, so there's something called Droplet, and there's something called airborne transmission. Droplet means that the little particles that the virus is in are very tiny. If you look at the tip of your hair, they're even tinier than that, okay? And we measure these in something called micrometers. So droplet particles that are about 5 to 10 can be larger than 5 or up to 10 micrometers in size. And therefore, you need that close contact to give it from one person to another. How does one produce these droplets? Anytime you cough or you sneeze, you're making droplets. And those droplets then enter someone else's mouth, someone else's nose, someone else's eyes in the area around you. And that's how infection becomes transmitted. Now, those are droplets. Another way of transmission is airborne. Airborne particles are much tinier. Okay, they're much, much tinier than droplets. And those viral particles can actually spread through the air. The wind carries them because they're so tiny. They don't have much weight. And so they can spread through the air from person to person. Now, I want you to understand that COVID-19 is spread by droplets and not by airborne in most situations. Okay, so it is spread by close contact with someone coughing, who's ill, who's coughing and sneezing and producing those droplets. Now, in some instances, those droplets can become airborne and spread a little bit more easily, and that's usually in a hospital setting. Okay, that's in patients who are intubated, need a special type of care, and under special conditions. Okay, but for our purposes, for everyone at home and on the streets, etc., COVID-19 is spread by droplets. Okay, that's the main way that it is spread, and that's why we talk about distancing ourselves and not having that close contact. Okay, and then people are always asking, what's being done? What do we know? And there's a lot of research being done. I referenced the CDC website earlier, the WHO website earlier, and this is to let you know that because this really is a worldwide pandemic, not just in our country, but all over the globe, people are looking into ways to treat this virus. They're looking into, how to identify it more. So there's all sorts of protocols that are being produced all over the world. So there's an international registry of patients that have been sick. So the more information we get from everyone that's been infected, the more we know about this virus and the better we are able to handle it, to understand it, and then eventually to treat it, okay? And to give you information on how to keep yourself safe. So it's very important that we continue talking to our colleagues and continue with doing research to understand and combat this virus. Now, I want to go on to know a little bit about what COVID is. Let's talk about symptoms. So does everyone need, so the symptoms of COVID are generally those that you see in someone that may have the flu. Okay, it's very similar. You're not feeling well, you have a fever, aches and pains, and then the cough develops. And now those sound like flu-like symptoms, and that's what most people with COVID have. Does that mean that everybody who has these symptoms needs to come to the hospital to be hospitalized? No. And I want people to remember that you can get the virus like any other virus. You can have the symptoms, but most people do fine and they recover. Now, there are people that don't do so well. And who are those people? So what are we looking for? Some people just have a common cold with a cough and fever and fatigue, and it goes away. However, there are warning signs. What are those warning signs? If you have trouble breathing, if you have chest pain, if your lips look a little blue, we're talking about people who have respiratory distress. That's what we call. So they have the signs and symptoms of COVID, the fever, the cough, etc. But now it's progressing into something more. All right. Now you need to be seen by a healthcare provider. All right. So this is the difference. And most people, like I said, will do fine. It's a cold, but there are people who will have some more severe symptoms, and those are the people that we really need to see. Okay. So when should I go to the hospital? Like I said, the common symptoms: fever, a dry cough. Some people also have GI issues, a little loose stools, body aches. Sounds a little bit like the flu, right? But when do I go to the hospital? If the fever is not going away, it's been over 3-4 days and the cough is worsening. All right. You have trouble breathing. You feel tight and pain in the chest. All right. So again, the respiratory symptoms are worsening. Then it's time to at least give your provider a call and discuss it with them. So that's when I think it's important for us to know the difference of when can we just handle it like a cold and when do we need to actually seek medical care. As parents, and many of you as caretakers of young children, is COVID-19 making young children sick, and how severe is the virus for them? So what we know now is it really is that adults make up most of the known cases, okay, that we have of COVID. That doesn't mean that children can't get it. Children can, and symptoms are similar. Again, it's those flu-like symptoms, the fever, the cough, the tiredness. Those are similar symptoms that children have as well as adults. However, what we found with kids is their symptoms tend to be milder, okay, and they usually recover pretty well. So they have the fever, the runny nose, the cough, the vomiting. Some may have the GI symptoms, but usually the respiratory symptoms are milder, and often they don't really need to come into the hospital and be admitted. Now, if your child has some sort of underlying medical condition or a special health care need, perhaps those kids may be at higher risk for severe disease. And the same thing applies as with adults. If there's trouble breathing, if the coughing's not going away, the lips look blue, the child doesn't look very responsive, as in any scenario, you would want that child to be evaluated by a healthcare professional. So keep that in mind. But in general, from what we have found from all our the research and the studies on children, it shows children tend to have milder disease than the adults do. And then the question always comes up that can I have COVID-19 and not have any symptoms? Okay, so that's a possibility. There are some people that may not have or may have such mild symptoms you really wouldn't think they're very ill. Again, it's not the majority of people, but there are some that will. So remember, there's a range of how this virus affects people. Some people, it could be very mild to very minimal symptoms, and some people end up in the hospital very, very ill. And there is a range to it. So it can go, you certainly can see mild, very mild, or no symptoms in people as well. And now, this slide is up because, remember, allergy season is coming, right? So many of us get nervous because we're waking up and we feel like our nose is stuffy or our eyes are itchy or what have you. And if you've had allergies in past years, you are going to probably have allergies again this year. So keep that in mind. So what are the most common symptoms we see with allergies? The sneezing, the runny or the stuffy nose, the watery, itchy eyes. Sometimes the ears feel a little congested. You have that tickle in your throat from postnasal drip. Those are your common allergic symptoms. And if you are someone who's prone to seasonal allergies, be sure that you'll have them again this year. It's not going to be any different. When do you get concerned? Again, we talked about the symptoms of COVID-19. What's less common with seasonal allergies is to have respiratory stuff where you have shortness of breath, where you are wheezing a lot, where you're coughing a lot, where you may have fever. It's unusual to see fever in seasonal allergies. Some people may have headaches just from the sinus congestion, but if those are getting prolonged, you're using your regular sinus medications that used to work last year but are not working, maybe it's time to call your healthcare provider and just get their take on that, okay? But things that, like seasonal allergies, we deal with them this time every year. And there's no reason why we wouldn't deal with them again this year. But this slide is just telling you what to be concerned about. Again, the respiratory issues, if they're prolonged, maybe it's time to talk to your doctor. And, we do get this question quite a bit from our patients about people who are undocumented and, how will I be cared for if I am undocumented in the event that I have symptoms? And I want anyone and everyone out there to understand that every single individual has the right to receive care, emergent or urgent care at the emergency room, regardless of your status, regardless of your immigration status. So your immigration status should not keep you away from a hospital if you feel that you are so sick enough to be there. Okay, so just keep that in mind. That's not something we're looking at. We're looking at how you are as how your well-being is, not what your immigration status is. Okay. Are there any medications I should stay away from during this time? There's really no clear evidence to avoid things like ibuprofen or Advil, Motrin, etc. There has been some suggestion that perhaps these medicines can make the symptoms of COVID a little worse for some people, but we really don't have a lot of clear evidence that it does. And if you are somebody that takes these medicines, I suggest, for whatever reason, arthritis, etc., I suggest you continue to take those medicines. Now, if you develop fever and you develop coughing, etc., some people are recommending using Tylenol or acetaminophen. And I think it's very important that you discuss this with your healthcare provider as well, especially if you're someone that's on NSAIDs for medical reasons. Okay, but there's no clear evidence to avoid that right now, and it's not what we're recommending. Are there any supplements that will help to boost my immune system or my child's immune system? And the way I answer that is if you have a good diet, that's the key, number one, and general vitamin supplements. Those are excellent. Just take a vitamin a day and that'll supplement your diet. Vitamin D, vitamin C, many of us take it on a routine basis. Sure, I don't think there's a harm in that. I wouldn't overload myself on D and E because remember, too much of anything is not good. But if you take a vitamin, you take a vitamin supplement, please continue to do so. We really don't have a lot of evidence yet. And again, like I said, clinical trials are underway that any of this stuff really works. People who've been taking vitamin C and vitamin D during flu season and cold cough season, if they feel it works for them, it works for them. So I wouldn't say stop doing what you normally do, but I certainly wouldn't start loading up on stuff when we don't have good enough evidence that it does help or doesn't help. I'll get to the question on testing for this now. So who's to be tested, and is there any specific criteria that I need to meet to be eligible? We are saying, and this is CDC data, that travel to areas with widespread or ongoing transmission, if you've been there, and now I believe entry to those areas is restricted if you're coming from the United States. But if you have been there, and you can see on the map, it's really China, Iran, Western Europe. If you've been to those areas, those are high-risk areas. And so if you've been there and you start developing symptoms, that's a clue. If you have been exposed to somebody who's known to have COVID-19, that is another specific criteria that we use. And of course, if you have symptoms that are worsening, like the fever that's not going away, the worsening cough, the sore throat, the flu-like symptoms, and if they continue to worsen, that may be criteria, and you may need testing. Now, the other question that comes up is, what if I haven't had direct contact with someone who has the virus, but I've been out in public and now I have symptoms? Can I get tested? And that's the tricky one because, again, if you have symptoms, it's important that you call your doctor or your healthcare center and you get an appointment. Many of our physicians now are using telehealth, and if they feel that they need to see you, they will do so in an appropriate setting. And, you know, they either you get a mask on, etc. But the number one thing is, if you don't feel well and you have a concern, you really need to call your doctor or your health center. I would avoid running to the closest emergency room, because remember, those are the sickest patients that are being seen in the ED. And unless you are severely ill and you cannot breathe, etc., and it's just getting worse and worse, absolutely, you need to go to the nearest hospital. But for someone who's just been out, has some mild symptoms, it's best that you first talk to your doctor or your healthcare center and see what they recommend. How do I get tested and where? So the hospitals are testing, but again, it's based on certain criteria. If you fit the hospital testing criteria, you will get tested. If not, then you won't. Okay. I believe the community health centers are currently not testing. And if you don't have any known exposure or you don't have any illness, we're just telling you to stay home and practice your distancing and use good hygiene. Okay. There are some New Jersey testing sites that are testing. You do have to log into them. I believe this one is PNC Bank, the NJ Motor Vehicle Center at Kilmer Inspection Center. So if you go online, the Department of Health, I believe you can get access to these New Jersey testing sites, and you do have to log on, and then there's a questionnaire that needs to be filled out, and they're basically using similar criteria as hospitals for testing. In other words, your symptoms, how you feel, etc., and then they give you an appointment to come in and get tested. I believe it's 7 days a week. The one in Homedale, I know, is 7 days a week. So there are sites outside of hospitals that are testing, but again, you can't just show up to them. There's a self-assessment, and you need to fill that out, and then they will give you some sort of direction as to when to show up, if to show up, if you satisfy the criteria. Those that do get tested for COVID, just to give you an idea of what the test is, it's not a blood test right now. It's actually, we use like a Q-tip type of a thing where we swab your nose, and that's where the virus sits, in the back of your nose. And that's how we test for the virus. So it's very simple. If you've ever had a strep throat test, or your kids have, you know, that little swab that they use. And this swab is actually put into your nose, and then we put it, we get the sample out from the back of your nose. It's not, it's a little irritating, I will say that. And then it's sent to the lab, and depending on the lab and how quickly they can process all these tests, it could take hours to days. Okay, so depending on where you are, you may not get that result back in a day, but again, depending on where you go, they will let you know when you can expect to get your test result. will my family need to pay to be tested for COVID-19? And what if I don't have health insurance? So for anyone who's staying home without any exposure and no symptoms, you're fine, stay put, practice good hand hygiene. You don't need to get out and get tested, okay? If you are sick and you have symptoms of fever, if you have trouble breathing, if you're coughing, you can't breathe, and clearly, then it's time to see a medical professional. It is in the best interest of everyone's health that any and every sick patient get treated, and no one will be turned away from the hospital regardless of insurance status, okay, if they're sick enough to be seen. All right, so again, it's the ones that are sicker, and if you have mild symptoms, please call your doctor. Do not show up in the emergency room. That's not what we're asking. We're asking you contact your healthcare provider. If you feel you are so sick that you can't talk on the phone, you're having trouble breathing, of course, that's when you need emergency care. And no one will be turned away from the hospital, regardless of insurance status. Can undocumented families get tested, and what happens if the results are positive? And again, anyone and everyone who fits criteria for testing can be tested if it's needed. If your test is positive and you are feeling sick or getting sicker, then with the advice of your healthcare professional, you should go to the hospital and seek care. If you're positive and are doing okay, very minimal symptoms or mild symptoms, and taking good care of yourself, that's fine. You stay at home. You practice social distancing with other family members in your house. But if you're positive, you don't need to come in to the hospital if you are not very ill. Okay, and like I said, most patients, it's a flu-like illness. Okay, we can advance to the next slide, please. Can undocumented families get tested? What happens if the results are positive? Same question keeps coming up, and this is in the U.S. Citizen and Immigration Services, the webpage that the USCIS encourages all those, including aliens with symptoms, to seek necessary medical treatment or preventative services. And this treatment or service will not negatively affect any alien as part of public charge analysis. Okay, so this was passed on March 18th. It provides coverage for COVID-19 testing for the uninsured through the National Disaster Medical System Reimbursement System. Okay, so again, if you need testing, if you need medical care because of this, your immigration status is not something that should affect that. Next slide, please. And I think I'll hand that over to Dr. Pai now.
Good afternoon, everybody. So this is Dr. Pai. As Eshaya mentioned, I'm a pediatrician over at Eric B. Chandler Health Center as part of Rutgers Robert Wood Johnson Medical School. So we're going to talk a little bit about how to prevent COVID. So next slide. Okay, so right now, COVID-19 is throughout the country, but it's really peaking in New York and New Jersey. So one of the things that we're asking people to do is just to really keep a close eye on your body and what kind of symptoms you're having. That being said, there are plenty of laws being made right now about not recommending travel and practicing social distancing. So what is social distancing? So, I know many of you have heard of this term, but basically it means to create a physical distance of at least 6 feet or 2 meters between people who do not live together. So that means staying at home as much as possible, only going out when absolutely necessary. So whether it means for grocery shopping or going to the pharmacy, it also means that you want to, when you do see people, you want to keep that 6 feet distance. Everyone should limit close contacts, whether you're inside or outside. And one of the things to keep it in mind is that really what the trying to recommend is no more dinner parties, no play dates, no birthday parties, nothing. So you're really trying to minimize social distancing when you're trying to optimize social distancing when you're outside. So what can you do to avoid exposure to COVID-19? How can I stay healthy and protect myself and my family from the virus? The best way to stay healthy is avoid being exposed. So again, that goes back to the social or physical distancing. It's spread mainly from person to person. So if you are within close contact of a person who has it, so less than 6 feet or 2 meters, and as Dr. Malhotra mentioned, if respiratory droplets of a person coughs or sneezes, and those droplets land in your mouth, that's how you get sick. If you are sick, it is in the best interest of the rest of the public that you stay home. And really important to remember to keep covering your mouth and nose with a tissue or the inside of the elbow when you cough or you sneeze in order to protect everybody. If I'm in close contact with someone and less than 6 feet away, can I get the virus? So like I said, it spreads between people who are in close contact with one another, and when that droplet lands in the mouth or noses of nearby people, and it gets inhaled to the lungs. Can someone spread the virus without being sick? So people who are most contagious when they are most symptomatic, which means is when they are really sick is when they're going to be spreading. So people who are sick with the COVID virus should really stay home and as isolated as possible. And one other thing to keep in mind is that the COVID virus spreads from contact with contaminated surfaces or objects. So again, remember, once you touch a hard object that has the virus and then you touch your own mouth or your nose or your eyes, that is how the virus can infect you. How many times should I be washing my hands, and how long should I wash my hands for? So I'm sure a lot of you guys have seen the public service announcements, but as a reminder, the most important thing you can do to prevent COVID virus outside of physical distancing is also washing your hands as often as you can. So at least 20 seconds with soap and water. And especially for our younger children, tell them to sing a fun song. So usually we hear about happy birthday song, but there's a lot of fun things on social media about other songs that you can have your kids sing or sing with them to make it just part of their routine. And also remembering the proper way to wash your hands by wetting, using a soap, making sure you get on both sides of your hands, and then rinsing and drying. You can also use a hand sanitizer, but make sure at least it has 60% alcohol in it. And again, really try to avoid touching your eyes and your nose and your mouth. What surfaces in my home are most likely to carry the virus? One of the questions that came up, I'm changing and washing my sheets daily. Is this necessary? So bed sheets, if no one's sick at home, you don't need to wash daily. And like Dr. Malhotra mentioned, the virus is living on hard surfaces. So think about frequently touched items like doorknobs, door handles, faucets, sinks, things like that. That's where the virus is living. But when you're thinking about bed sheets, clothing, towels, linens, you just want to really follow the usual recommendations. You don't need to shake the dirty laundry. Wash as per the manufacturer's instructions. Use the warmest appropriate water setting, and then dry everything completely. One of the things to keep in mind is that if you have a person that's living with you that is sick from coronavirus, you can wash their dirty laundry with yours, as long as you're using the warm temperature setting. And just this slide kind of gives an example of what things that you can use to kill COVID-19. So some brands that are commonly used are Clorox disinfecting wipes, Lysol brand bleach, Purell. Many of these are really registered for the EPA and are safe and have been shown to kill the virus. Do I need a mask or gloves? What about my children? Where can I buy these items? So as I'm saying this, a lot of times when we're giving these presentations, things are changing every minute. So I know recently they're saying that you can wear a mask when you're outside, but I think the other thing to really keep an eye on or just be mindful of is that with masks, we're running out as healthcare providers. So we're saying that's really only recommended for sick adults or children. And even when you have a mask, realizing that you have to know how to take it off and without infecting yourselves or others. So because you want to remove it from behind, you don't want to touch the front of it because that's where the virus would be if you are exposed, and you want to just put it in the garbage immediately. And again, wash your hands immediately afterwards. With gloves, there really is no need for gloves at home. If you do use them, they can't be used over and over again. And I think one of the things I'd like to say about reusable gloves or disposable gloves, I feel like it gives people a false sense of security, thinking that if they wear gloves, that they're going to be safe. But too often I see people using gloves in the grocery store, and then with that glove that may be dirty because they were pushing the shopping cart, then they scratch their face or they scratch their nose, and that is how the virus is spread. So it's the best thing you really can do is just wash your hands with soap and water. Our telehealth service is available instead of in-person pediatric visits in the event my children get sick with a fever or other symptoms. So like I said, I work over at Eric B. Chandler Health Center, and we are really trying to use telehealth as much as possible. It's for the protection of our patients, their families, and for us as providers too. We are only, for us over at Eric B. Chandler in New Brunswick, we are only letting people who are babies who need their vaccines and their well child visits for children less than 15 months old. And we have sick patients, then what we'll do is we'll call them over the phone or telehealth, and we'll decide if the patient needs to be seen in our office or needs to go to the emergency room, because we want to protect our children as much as possible and all our patients. Testing positive. So if someone tests positive for COVID-19, what do we do? So when we have a household member that tests positive, if they're mild symptoms, they're just going to self-isolate, and I'll talk about that in a second, and you want to quarantine the household. If the person is sick, again, they're going to go to the hospital. So what is the difference? And this can get confusing. So self-quarantine versus self-isolation. Self-quarantine is basically the shelter-in-place mandate that we've heard from our governor and happening in many states, which means if you self-quarantine, you don't want to go to the stores or interact with the public, stay away from household members as much as possible. If possible, sleep in a separate space from the family members. So who should be in self-quarantine? Anyone who does not have symptoms but had close contact with someone who later became infected. Or if you live with someone who is in self-isolation. And what is self-isolation? That is someone who would need to be confined to a separate room with minimal contact with household members. That includes pets too. If possible, use a separate bathroom. If not, if you only have one bathroom per the household, then every time that person who has the COVID-19, the bathroom should be cleaned. And the person who has the COVID-19, food trays should be brought up to their room and the person will pick up the food trays left at the door. And again, who should do this? If someone with a positive case of COVID-19, a person who's waiting for test results about COVID-19, and person who has the symptoms that all fit the COVID-19 and may be waiting to be tested. So again, back to Dr. Malhotra's point, if a person has all the symptoms but does not have any life-threatening component of the virus, they should be in self-isolation. And people ask why 14 days? So 14 days is considered the incubation period. The incubation period was determined by a study out of Johns Hopkins University, where the majority of people, or 97% of people who develop the symptoms of the virus, will do so within the first 11 days of exposure. So that means the majority of people who are exposed to the virus will show some symptoms within 11 to 12 days of their exposure. Where have people in New Jersey tested positive for COVID-19? Have children been testing positive for COVID-19? Have any children died from this virus? So as I said, the data keeps changing on this because as we know, this is changing every hour to every day. And this graph that I'm showing you the highlights of where the virus is. And this was just from a couple of days ago, so I know this has changed. In New Jersey, patients are still being treated in the hospitals. And when I say being treated for COVID-19, there's no magic medicine yet, but it is making sure that they're not dehydrated, giving them IV fluids, they're not having any difficulty breathing, so if they need extra oxygen, or if they need extra support and then needing to be placed on a ventilator machine. If a patient who's admitted to the hospital with COVID-19 is feeling better, then they can go home. But once they go home, they need to be put into quarantine. We are seeing COVID-19 in babies and young children. As of right now, they are doing well. And reported death among children is quite rare as of right now. And it's usually seen in children who have some underlying illness or their immune system is weak. If I tested positive for COVID-19, will I have to get tested again to find out if I still have it? If not, how will I know it's gone? An asymptomatic patient, retesting is not going to be done due to resource limitation. As you've all probably heard in the news, we don't have enough COVID tests. If you remain asymptomatic for 14 days after being positive, it is likely that you're not going to be symptomatic. After recovering from the virus, can I spread it to others? So you have to be careful still. You may still have some virus shedding, but overall you most likely have developed immunity from it. But shedding from a well person is less likely. Can I return to work? It really depends on your employer, and you want to make sure that you don't have any symptoms. Can the virus be transferred to an unborn child or through breast milk? There still is really no definitive or clear information about this. After birth, babies can get infected, and it could be from their mother who may be sick or from another family member. However, they don't get very sick from it. So one of the things that we also wanted to talk about is how do we support ourselves, our family, and our community during this pandemic? So I apologize, this screen again is a little bit old. This is from a couple days ago. So what is community spread? How do we avoid community spread? So community spread is when people are infected with the virus in an area, including those who are not sure how or where they became infected. When the virus first came to the US, we were asking about exposure to travel or were they interacting with someone who is positive with the virus. But community spread is now we're just seeing it pop up, infected individuals without having a specific idea who they may have been exposed to. That being said, one of the questions I get asked often is, can I go outdoors? And that's an absolute yes. It's really important for our physical and our mental health that we go outside at least every single day. I recommend at least twice a day if possible. However, one thing to be aware of is that for younger children, it may be harder for them to keep away from other children. So we talk about that 6-foot distancing. You have to be aware that your kid may not have that ability to stay away from other children. And for those kids, you want to make sure that they limit any kind of interaction with other children. However, we recommend choose parks, open fields, hiking trails. You don't want to go to playgrounds, and I think many playgrounds are all closed throughout New Jersey. And the reason is that playgrounds, a lot of the equipment have contaminated surfaces, and the virus can live longer on those kinds of surfaces. And they're more crowded, so it's going to be harder to avoid other children when you're at a playground. If you are going to have your child play sports, remember, if that child, even if they're older and they're throwing a ball from themselves to a friend, they're touching that ball. And if that ball has a virus, the other kid is catching that ball. And if that kid then puts his hand on his face, that's another way that that disease is going to spread. So what is safe? Running, walking, biking, hiking, and you can do that with a household member. Remember, we have to keep that physical distancing and limiting our exposure to people from other households. And it is safe to drive. We have gotten that question often. It is safe to go in your car and drive around, especially if you need a change in scenery. But whatever you do, as soon as you get home, you wash your hands. How can I best protect myself when grocery shopping? One of the best things you can do is go during off-peak hours if possible. You want to avoid crowds. I've seen a lot of grocery stores in the area who are making sure there's at least 6 foot between people who are waiting to go into the side of the grocery store, and that's because they're limiting the number of people who go into the grocery store at a time, which I think is a fantastic idea. Another thing you can try and do is wipe down the handles on the shopping cart. Again, try not to touch your face while shopping, wash your hands before and especially after, and try to keep that physical distancing of 6 feet. After you come home, we're hearing a lot of things that are out there about what to do with your food. It's just, again, common sense. After you unpack your food at home, wash your hands again. And you don't need to clean all the surfaces of all the packaging. It's just about washing your hands again after you unpack things. What I should keep in my home in case I develop symptoms. So I really recommend that you look at the CDC website. It has a lot of great information and a lot of great resources about what to keep. One of the things that you want to do is when I keep saying physical distancing, I'm specifically avoiding social distancing because it's really important that you keep in touch with family members, have an emergency contact list, especially for those of you who live by yourself. If possible, prepare for the illness. Sometimes it can be difficult, but for those of you who have an extra room, make that the sick individuals are going to be if you need a place for them to be separated from others. You want to really just clean and disinfect frequently touched objects like we talked about earlier. And then make sure you have Tylenol and extra fluids at home if needed. Can I order takeout or delivery? Is this safe? If so, what precautions should I take? So the main risk from ordering food is just having contact with other people. So for example, if you order food from someone and the delivery person is infected, and if they sneeze or cough on you, that's how you can get infected. Meaning the virus will spread from person to person, so from delivery person to you. Less likely you to get virus from touching the packing. There is no risk of contracting the virus by eating it in cooked food, because remember, it is not a foodborne illness. There's very minimal risk by touching raw food that the virus is on and then touching your face. In general, if possible, ordering food is actually pretty safe. It's safer than going to the grocery store or a restaurant because you have less contact with people. Another question came up: how do I protect seniors and high-risk individuals while grocery shopping? So we're really recommending for seniors to go during those reserved hours. Our goal from a public health perspective is really protecting our seniors. So having them go do their senior hours, having them shop online, whether it's for a pickup service or delivery straight to your door. Within New Jersey, there's quite a few grocery stores that are making these special hours and reserving these hours for our elderly and high-risk community members. If I'm not exhibiting any symptoms, but I have been out in public, can I be around other people like my grandparents? You know, this is a really hard one because a lot of our seniors face social distancing or isolation as it is, but really being mindful, how do we protect them, but help them at the same time? So you want to stay away from nursing homes and retirement and long-term care facilities. Older adults should really avoid contact with children. As we remember, Dr. Malhotra mentioned that children a lot of times will have no symptoms and they can pass on the symptoms to the grandparents. So for example, a child might have the disease, but they might have maybe a little bit of a runny nose, maybe a mild cough, or no symptoms at all. But if they're around their grandparents and they have that virus, unknowingly they will spread it to those grandparents and they have a risk of being a lot sicker. So how can we help our elderly? You can do virtual visits, set up FaceTime calls, deliver care packages for them, or even offer to do their grocery shopping. These are all multiple ways we can support the elderly in this time. How long do you think social distancing will last? How long will it take for the virus to disappear? That's a really hard question. So we keep hearing the term of flattening the curve. So as you can see on this slide, the cases are going to keep going up and up unless we practice physical distancing. That is the only thing that we have seen that's truly made a difference in minimizing the spread of this disease. Other thoughts? Is there a vaccine? As Dr. Malhotra mentioned, there's a lot of people doing a lot of great research looking for the vaccine. As of right now, we do not have a vaccine available, but that's one way that we can think about eliminating the effects of this. Another thing is a herd immunity. So herd immunity is basically when a lot of people all get the disease at once and then they all become immune. However, we don't know how sick someone's going to get once they do get infected with the virus. So that is not a fail-proof way. What can I do to stay safe? So should I go to work if there's an outbreak in my community? Stay home if you can. I think right now we're beyond this point in New Jersey. If you are still going to work and you feel that you need to be working from home, it's really important that you communicate with your employer. Taking leave, if you or someone in your household gets sick, it's very important that if you are sick, you stay home. In our healthcare setting, every day when I go to work, they are asking me if I have a fever or cough or shortness of breath, or have I been in contact with someone who has COVID-19 symptoms. So we are doing that in the healthcare setting. So I'm recommending that across all employer settings as well. Whoops. Sorry about that. Will warm weather stop the outbreak of COVID-19? So Dr. Fauci, who is now a celebrity from the National Institutes of Allergy and Infectious Disease, so a few days ago, he said the seasonal cycle to the pandemic is possible, so maybe it could help. It could help in parts of North America and Europe, maybe during the summer months, but it could still come back in the fall. So basically that is a big, I don't know. We really don't know yet. As you guys have seen in the news, we're still learning as we go along. Will school be canceled for the rest of the year? I have no idea. We are seeing some of the private schools in New Jersey have been canceled for the rest of the year, or they're just going to virtual learning until the end of the year. I have not heard anything from our medical perspective about schools being canceled for the rest of the year. How can parents and teachers provide socialization opportunities during COVID-19? So one of the things, especially with spring break around the corner, it's really important to continue with routines, even social ones, and being as creative as possible. So there are the virtual ways, so the virtual play date. So you can do a Zoom play date, a FaceTime play date, and over those you can just do a simple game of charades or Pictionary, and just being as creative and sharing those ideas with your friends and things that they can do. Virtual game night. You can set up a time for kids with other families to play their favorite board games, whether it's Monopoly or Yahtzee, and there's a website for that too. Pokemon Go is another way to kids get outside, interact with their friends from a distance, and even track their activity in the game as well. One of the ideas that I liked was this neighborhood scavenger hunt. So these are popping up in communities such as Brooklyn, Philadelphia. So basically it's a game of I Spy, also called the Quarantine Rainbow Connection. So in Brooklyn, what they did was they created a Google map of all the homes that are participating. So parents are going with their children and looking for rainbows that have been put in the windows. So all the neighbors are having their children paint rainbows in any way and put them in their windows. And then you go around from house to house, apartment to apartment, and find those windows with the rainbows and maybe wave to a neighbor or friend from a safe distance. It's a great way to connect with your community, connect with other children, and of course, getting that fresh air and exercise. Stress and coping during COVID-19 pandemic. Now that we're almost done with our third week of quarantine, this is something that we're seeing more and more commonly. One of the things to keep in mind that stress during an infectious disease outbreak can include many symptoms. One of the things I encourage that you to look for in yourself or in your friend or family, if there's fear or worry about your health or the health of your loved ones, if people you know are having decrease in sleep or change in their eating patterns, eating more or eating more less, having difficulty sleeping or concentrating on typical routine behaviors. If you see a worsening of their chronic health problems, so once you're under stress, your body's immune system functions at a weaker course and you're gonna have worse chronic health problems. If you see that people or yourself are trying to cope by using alcohol more, smoking cigarettes more, or other drugs more. So what can we do to support ourselves? One of the most important things I recommend is taking breaks from the news, limiting how much exposure you have to watching, reading, and listening to the news, especially social media. A lot of times we see a lot of false information that's out there, and it can create more anxiety. But what can we do is connect with others. So I think this infographic just reminds us that it's really important that we continue to eat healthy, Exercise as much as possible, as long as you're practicing that physical distancing. Hydrate, lots and lots of water. Making sure you get enough sleep. For adults, that's anywhere between 7 to 9 hours of sleep, and for children, it's more. Another thing when we're trying to keep our routines, make a task list and mark off everything that you need to do for the day, and just kind of keeps you on track and make sure that you maintain those routines. So I want to take a little bit more time to talk about stress in children. Younger children may have stress and show it in different ways. So they might cry a lot more, seem a lot more irritated, return to behaviors that they had before that now they're kind of outgrown and now they're regressing. So they might start wetting their bed, have accidents with the toilet. They might start showing some excessive worrying or sadness, or eating unhealthy or sleeping unhealthy that we talked about in adults too. Teens, on the other hand, they might start acting out. They might start doing poorly in school or avoiding school or just not participating in school as they may have before. And just having difficulty with attention and concentration. You also might see the things that we see commonly in children with unexplained headaches or body pain, and start medicating themselves with alcohol or tobacco or drugs. So one of the most important things we can do for children and our students is talk to them about what's going on, answer any questions they might have in a way that they can understand. We don't want to use, and I know I'm guilty of it, as medical terms. Really talk to them at a level that they'll understand depending on the age and maturity of your child. One of the things that you really want to make sure is let them know that they are safe. You want to have that reassurance and give that reassurance to them. But let them know it's okay if they do feel upset. And you can tell them how you feel and how you're dealing with your own stress. I think a lot of us all have some level of anxiety about this, but let them know that it's okay that they're stressed and that I'm stressed too. Again, you want to make sure your child has limitations to how much news they're watching, how much social media they're seeing, because they might misinterpret things just as we do as adults and not understand what they're hearing or seeing on the news or social media. Routine, especially with spring break, really maintain their routine. Whether a mixture of learning and relaxing or fun activities, but be a role model in that. We got to practice what we preach. It's important that we show that we have our routines, that we're also getting plenty of exercise and eating healthy as well. And as much as possible, connect with friends and family, whether it's virtually or over the phone. And I just want to give some tips about how to explain the virus to my children. And this is from the CDC. Being supportive, healthy, providing an reassurance, and keeping the family connected, and routine. There are a lot of resources that are out there. You guys will have a copy of these slides. Some of the ones that are out there come from different associations: American Psychological Association, Counseling Association, SAMHSA. Also NJ211, I highly recommend that you guys check that out for more resources. I did want to include a few of these, and I know these pictures are small, but it's about positive parenting during COVID-19. These are all available on the World Health Organization website, but it just talks about how to parent in a positive way, especially with spring break coming up. It's going to be up to us as parents and as teachers and as adults to be creative of how we're going to talk and spend time with our children. So it could be one-on-one time, making sure we're trying to be as positive as possible, and structure or routine. Also, how are we going to respond to quote unquote bad behavior? And as much as possible, keeping calm ourselves and managing our own stress. So making sure that we take a break. We all need breaks from one another and our children. So making sure we maintain that positivity and calmness and manage our own stress. And then of course, talking about it is important, listening and just being honest. And it's okay to say, I don't know. I think that's one of the most important things. Here's some more resources. A lot of our families and ourselves are experiencing some difficulty with finances given the highest unemployment rates that we're seeing now. But there are places that are helping. So singlestop.org is something that has specific facts about New Jersey resources, talks about food insecurity, housing insecurity, and it helps people look for local resources in their neighborhood. NJ211, which I mentioned before, has behavioral health help and access to basic needs resources. And you can always text NJ COVID if you want to get text regarding updates. But again, I would recommend that you are careful and you want to limit how much exposure you have to getting that inundation of news. There's also SPAN, which is the Statewide Parent Advocacy Network, which has a 30-minute family talk. So it's a great way to connect with other people, talk about school closures, talk about health and mental health needs. SNAP and WIC, which provide resources for food, has adapted their eligibility program. So now they're being more flexible and who's eligible and what foods they can buy. There is the COVID-19 NewJersey.gov, where you can find testing location, more resources. Early Childhood Development Action Network, some ideas for play, homeschooling, virtual schooling, and how to help children cope with stress. With that being said, I'd like to thank you for your time. I apologize that we went a little over, but we'd like to open up to see if you guys have any questions for us.
Thank you so much for that, Dr. Pai and Dr. Malhotra. If you have any questions, you may enter them into the chat if you see it on your computer, or you can send us a message through Facebook or Instagram, because we're going live on both of those currently. So a question we received on Instagram was that the student was concerned on whether or not COVID-19 germs attach themselves to the bottom of shoes and Playtex gloves.
Okay, I can take that one. Can you hear me?
Mm-hmm.
So there are studies that show that the virus can attach itself to different materials, including plastic and latex, and it could be for a few days. So the answer to that would be yes, but remember, they're not magnets, right? So you actually have to, if you're wearing gloves, and that's the concern I have with people out in the public just putting gloves on, because you cough on it and stuff, and then you rub your face. Yeah, your hands are fine, but now you got this stuff on your face. So yes, it can, but again, the virus has to be in contact with those things. It's not like it's going to just out of the air get attracted to plastic. So if there's someone at home who's sick, or if you're walking outside, I mean, I know this question comes up, but you have to remember that we know that the transmission is person to person. So someone has to cough and then give it to someone else. It's not shoe to shoe, right? So what do I say to that? I say, well, if you can take your shoes off outside, not track them indoors, don't have little kids touching those shoes and then touching their faces. I think that's the bigger issue. So the short answer to your question is yes, we know it can stick to plastic, but you have to be exposed to that virus in order for it to find that plastic to stick to. And then, use common sense when it comes to things like, tracking shoes inside the house if there has been that exposure.
Thank you for that insight, Dr. Malhotra. Another question we received: is it necessary to always wear a face mask when you go outside?
So right now, so we probably may get to the point where it is being recommended that it's an option to be considered. And the reason that, I guess it sounds like I'm hedging the question, I'm not, is because what kind of face mask are you going to use? Remember, one of the problems we're really having is people who need these masks, people who are on a day-to-day, hour-to-hour basis in contact with COVID positive patients. I'm talking about healthcare workers. They're not able to get these masks. And so one of the concerns I have is if the lay public takes all these surgical masks, how are we going to take care of our patients? So what kind of mask? I know cloth masks have been used, and some people like to use those, and those should be adequate to cover your nose and your mouth. This is a question that has been receiving a lot of attention. There's no clear answer. I would say go with your comfort level, but I think the issue really is what kind of mask are you using? And if you're getting, surgical type masks that really belong in hospitals, then I say if you're really that concerned, please think of using a scarf or, something that will just cover droplets coming in because clearly we're practicing social distancing, right? So we shouldn't be up in each other's face anyway. And this is just to protect you in case you have some sort of viral droplets or whatever passing by. And that should be sufficient, either a cloth mask or scarf or something in front of your nose and throat. But I would plead to everyone to please leave the surgical masks for those healthcare workers who are frontline and really dealing with patients on a face-to-face basis and can't do social distancing because we really need to see our patients. They're the ones that should be getting hospital-grade masks.
Thank you. That makes a lot of sense. Another question we received on Instagram from a student: will the coronavirus affect children ages 13 through 15 badly, or will they be able to survive it?
We really don't know. I think, we're hearing stories from around the world. I think the people, again, who are at higher risk are those who have those chronic diseases like high blood pressure, breathing problems such as COPD or chronic obstructive pulmonary disease or asthma. So we really can't say one way or the other or for sure that anyone is protected from this.
Thank you. Hopefully that puts some of us at ease. Another question that adults were having: if someone's on medication for other underlying health issues, does that affect their chances of contracting coronavirus?
So it depends on what your underlying health condition is. And we know people who are immunosuppressed, people who have pulmonary issues, people who have heart issues. Yes, they are what we consider a high risk. What does that mean? It doesn't mean that the virus is going to come out and target you, okay? You have to be exposed like everybody else. So if you're practicing social distancing, which is why we are asking you all to do that, hopefully you'll protect yourself from, and your home, and hopefully you'll protect yourself from getting the virus in the first place. I think the concern is once you've contracted the virus, the high-risk groups may actually be the ones we're concerned may get sicker. So remember I said the majority of people, hopefully it'll be more of a cold flu-like illness, and hopefully you won't ever need to see a doctor in a hospital or an emergency room. But the high-risk people are the ones we're concerned if they do get exposed to the virus, and I'm not saying all of them, but there's a greater chance compared to the rest of the population that their symptoms may be more severe, and therefore they may require a hospital or an emergency room. So I hope that answers what you're asking.
Yes, thank you.
Eshaya, if I may, I'd like to ask one of the questions that came in through our chat. So for those that are choosing to use a mask, a fabric mask, are they able to reuse a fabric mask if they wash it?
Yeah. As long as you're washing your clothes, you're washing your mask. I think that makes sense. And I would say absolutely, I would wash it.
Thank you.
Thank you so much, Dr. Malhotra and Dr. Pai, for all of your insightful guidance today. We've spent an amazing hour with the both of you, and thank you for providing so much information to the parents, community members, and students of New Brunswick. We'd also like to thank once again the New Brunswick Board of Education for making this amazing opportunity available to the public. And of course, if you have any questions regarding your students' status of going to school or anything else that the district has to provide, those resources are available online at nbpschools.net. We thank you once again for attending this Ask the Doctors webinar on COVID-19 and wish all of you a healthy and safe afternoon.